There is a fungus spreading through American hospitals right now that cannot be killed by most of the drugs doctors have to treat it with. It is not new, but in 2026, it has already infected more people than in any year since it first showed up on U.S. soil, and it is happening quietly inside the buildings where you send the people you trust to get better. The fungus is called Candida auris. It was first identified in the United States in 2016, and for years it stayed mostly contained to a handful of states and a small number of outbreaks that made a little news and then faded. That is not what is happening anymore. As of mid to late 2026, the CDC has confirmed more than 3,000 clinical cases spread across 23 states, and that number is provisional, meaning it is still climbing as more facilities report. To put that in context, the entire country saw 2,800 cases in 2022. That number jumped to over 4,000 in 2023. Last year it was around 3,300 for the whole year. We are on pace in 2026 to blow past all of it, and we are barely past the halfway mark. Texas has it worse than anywhere else, with over 700 confirmed cases, already higher than all of last year combined. Michigan is second with over 500 cases, which is worth sitting with for a second, because Michigan is also the epicenter of the cyclospora outbreak we have been covering on this channel, the one tied to contaminated lettuce that has now caused 2 confirmed deaths. That is 2 separate, unrelated public health emergencies converging on the same state, at the same time, stretching the same hospitals and health departments thin. Illinois, Ohio, Nevada, New Jersey, Arizona, Maryland, and Virginia all have case counts in the triple digits as well. Here is what makes Candida auris different from a normal infection. It is frequently resistant to the antifungal drugs doctors would normally reach for, which means when it does become a serious invasive infection in the bloodstream, the wound, or the ear, there may genuinely be no treatment that works. The CDC's own historical data on this pathogen states that between 30 and 60% of people with invasive Candida auris infections have died, though it is important to say clearly that most of those patients were already critically ill with other conditions, so the fungus was rarely acting alone. Still, when a hospital cannot treat an infection at all, that changes the entire calculation for a family with a loved one already fighting for their life. Who is actually at risk here matters, because this is not a general public health emergency the way food poisoning is. A review of cases from 2022 through 2024 found that around 88% of clinical cases were in people over the age of 45, most of them men, and the overwhelming majority in acute care settings. The people getting sick are hospital patients on ventilators, people with central lines or urinary catheters, and residents of long-term acute care hospitals and skilled nursing facilities. If you are generally healthy and not in one of those settings, the CDC says you are very unlikely to become infected or even colonized. This is a story about what happens inside a hospital or nursing home, not about your kitchen counter or your grocery store. But here is why families should still care. Candida auris can live on a person's skin without making them sick at all, which means someone can be colonized and contagious without anyone knowing. It survives for long stretches on hard surfaces, bed rails, blood pressure cuffs, shared medical equipment, and it moves from patient to patient through contaminated surfaces or through the hands of caregivers who do not know they are carrying it. If you have a parent in a nursing home, a relative in an ICU, or anyone in your family with a long-term catheter, feeding tube, or breathing tube, this is worth a direct question to their care team. Ask what their facility does for Candida auris screening, whether they use dedicated equipment for colonized patients, and what their hand hygiene and disinfection protocol looks like. Experts recommend rapid diagnostic testing specifically because older lab methods have been known to misidentify this fungus as something more common and less dangerous, which delays the isolation precautions that actually stop it from spreading room to room. The pattern here should sound familiar if you have been watching this channel. A threat that federal agencies have already labeled an urgent antimicrobial resistance threat is spreading faster than the public conversation around it, tracked in provisional numbers that update quietly on a government dashboard, while most people have never heard the name Candida auris at all. It is not dinner table news. It is happening inside the buildings we trust the most, to the people who can least afford another fight. We will keep watching where this one goes, especially in the states already stretched thin by other outbreaks this summer. If you want more of these investigations before they hit the mainstream news cycle, subscribe so you do not miss the next one, and like this video so more families with a loved one in a hospital or care facility actually see it.